how often do you say, oh, she just all of a sudden got younger, or he all of a sudden got really younger, looks fantastic? Or do you think, oh, what happened there? What did they do that for? They didn't look that bad. I got to say, there are a handful of people who I think have, you can tell that they got work, and you could say, wow, they look great. But most of the people, you're like, what did they do that for? And some of these, I feel bad watching TV and see some women do it when they're under the age of 30. But I guess they think that it's a pretty competitive industry and you got to stay in front of the crowd. And maybe there's one trophy wife knowing that her best before date is not too far away. I don't mean that in a bad way. I think that's the way she thinks because she's arm candy until maybe only a certain age. And there's another piece of arm candy on the horizon. Anyway, 65% of people in a new survey said that they regret the plastic surgery that they've got. Only 25% of the people say they're thrilled with how the surgery turned out. The biggest reasons for regretting it are the complications or unexpected side effects. So they're not even the reasons that I tried to front there, that most people, you're like, yikes, sorry about that. I was going to say that they were shocked with the results, but they just look that way. That's maybe the truth, or maybe it's not the truth. Frank Lista joins us right now. He is the founder and the director of the Plastic Surgery Clinic. Frank, thanks for your time.
Hey, thanks for inviting me.
And I'm wondering if there's any men or women listening right now. Maybe you got some work done and you're like, wish I didn't do that, because maybe it's like a bad tattoo that you can't get undone. But Frank, you don't necessarily buy the numbers. I know you wanted to point out that this is a British study, but I'm not sure that the work is any worse there off in Britain, is it?
Well, I just came back from being the visiting professor at the Royal Society of Medicine in London, speaking on plastic surgery, and the situation's way different in England than it is in North America. They have a bunch of problems in the way they do plastic surgery because a lot of the cases aren't done by plastic surgeons, and they have these plastic surgery factories where you never see the plastic surgeon before you actually have the operation. I mean, those kind of things don't happen here in North America. Now, we don't have 100% satisfaction rate either, but our numbers are actually exactly the opposite. So we've run those studies here in the American Society and Canadian Society of Plastic Surgeons, and our numbers are more like 89% of patients are happy and would do it again or recommend it to family and friends. The interesting thing is that we're not 100% either. We've got that 10 to 20% that are unhappy, and those are the people we're trying not to operate on or figure out what we did wrong.
What are their expectations? The people who aren't happy, why are they not happy?
Well, there's two groups. There's the group that has a complication. They're never happy. Although, interestingly, if you nurse a person through a complication and, they have an infection and you get them through it and at the end everything turns out all right, they're often not regretful. I mean, they're regretful that they had their complication, but not regretful that they had their operation. The more important group is the group whose expectation has not been met, and that is really a failure in plastic surgery.
And what are we talking about? They don't look young enough? Their breasts aren't big enough? The liposuction?
So remember, it's not just face surgery we're talking about. It's breast surgery, tummy tuck surgery, and so if you take a tummy tuck, for example, our typical tummy tuck patient is a 40-year-old woman who's had a bunch of kids, maybe a cesarean section, maybe some other surgery. She's not going to look like she did when she was 18 before she had kids. And if her secret desire is to look like that, then you're going to be disappointed. Or if you're a man and you're having your eyelids done because it's going to help save your job and it doesn't, if we don't meet your motivation, then it doesn't matter how good the operation is, it's a failure.
Yeah, I guess if you're a guy or if you're a woman and you thought it was going to help you help your spouse, and they still leave, and then they blame you, and there's no amount of work that you can do on a person if they don't like themselves or if they're an awful person. They still won't be able to attract maybe the opportunities or the spouse that they would like. I wanted to ask you in a second, Frank, how often does somebody come in to see you where you say there's nothing wrong with you, you're too young, any number of different things, and you kick them out and maybe tell them to, I don't know, go see Anthony Robbins or something. I don't know what you would tell them, but that in a second. And I'd actually like to hear from people. If you had some work done, I was going to ask you if you weren't happy, but Frank says that the numbers are different here. Frank Lista is the founder and the director of the Plastic Surgery Clinic. 65% of people surveyed said that they regret the work that they got done. But these numbers, according to Frank, here in North America, aren't accurate. 416-872-1010. Star Talk is star 8255. It's In-Depth Radio in Toronto. Newstalk 1010 Time Saver Traffic. I'm Jim Richards. We're talking about some numbers. A survey said 65% of people who had work done, plastic surgery, are not happy with their work. Now, these are British numbers. Apparently, they don't translate that well here in North America. But I'm wondering if you're one of those people. Or maybe you're one of the people who looks at somebody and goes, yikes, what do you get that done for? Frank Lista is with us. He's the founder and the director of the Plastic Surgery Clinic. And what of it, Frank? How many people who come to see you do you say, there's nothing wrong with you, get out of my office?
Well, we say it in a little nicer way. But that happens all the time. I'm doing consults this morning, saw a patient this morning who asked me about a facelift, and I said, you know what? You don't need it yet. And it's important for me to say that because plastic surgery isn't just about doing a great operation. It's about making a patient happy. And if you can't deliver a result that meets their expectations, they're not going to be happy. So we probably don't operate on about a third of the patients who come in the door to see me.
Now, what would you say to me? And I say most plastic surgery that I see on people, I say, wow, what did you get that done for? Because I don't think anybody looks at somebody who's got plastic surgery especially on the face, and says, wow, that makes you look younger. Usually you look at somebody, and with due respect, because I know this is kind of your field of expertise, but most of the time I look at somebody and goes, oh, you got plastic surgery.
Hey, you know what? Those kind of cases horrify me as well. But let me, really, really good plastic surgery is undetectable. So people who've had plastic surgery, you can't tell that they've had it done. That's when we've done a really great result. I look at some of these, Hollywood personalities, and you can barely recognize them anymore, and I'm horrified at those results. So those are the cases that give plastic surgery a bad name. But if it's done really well, you can't tell. They just look rested, relaxed, but you don't know what's changed, and it can be that good or it can be that bad.
Yeah. And have you done a lot of famous people here in Canada? Can you tell us their names? Tell us the names of the people that we wouldn't know.
You wouldn't know. That's right, and that's the idea. All you say is, wow. Or you don't say anything. You don't even notice. They just look somehow subtly different.
But how often do you say, hey, I could have done that better because that's a disaster and you should be starring in a horror movie?
Listen, all you have to do is Google bad plastic surgery, and those are all horror stories. And, I have patients asking me all the time. They say, I don't understand. This person has all the money in the world. Why didn't they have better plastic surgery? And I say, well, just because you have all the money in the world doesn't mean your plastic surgeon's any good.
Frank Lista is with us again. He's the founder and the director of the Plastic Surgery Clinic. 65% of people, apparently, according to numbers out of Britain. Frank's telling us those don't translate here. But the reason we decided to get you on is because 65% apparently in Britain said that they regretted getting the work done. And you're telling us that is the exact opposite here. I think I was going to ask one more question, but I think we're done, Frank.
Yeah, the interesting thing is that I spend more time operating on people's expectations than I do than actually operating on the patient. I want to know why they're having it done. Like, why do you want it? And if they say, look, I want it because I want to save my marriage, that's not going to work. And if they say, look, I'm perfectly well adjusted, I just don't like this little bump on my nose, then that makes for a better patient.
All right, I appreciate it, Frank.
Hey.